So, my topic is about tuba-tuba or tubang bakod. In English, it is usually known as pig nut or porging nuts. Scientific name is Jatropha corcas. In Visayan, it is called kasla. So, Jatropha corcas is a large coarse annual shrub or small short-lived tree which can grow 3.5 to 4.5 meters and 8 to 15 tall. It has thin, often greenish bark, which exudes copious amounts of watery sap when cut. The leaves is dark green, alternate, simple, ovate to slightly lobed with 3.5 indentations. Flowers is yellow to green in color and being small, mostly hidden in foliage. The fruit is small capsule-like. These are green and fleshy when immature, becoming dark brown when ripe and splitting to relapse 2 or 3 seeds, each about 2 centimeters long. So next is poisonous parts of the plant. The main toxins contains a purgative oil and phytotoxin, toxalbumin or quercetin, similar to ricin in ricinus. Quercetin is a phytotoxin found mainly in the seeds and also in the fruit and sap. Purgative oil. The seed yields 40% oil known as hell oil, pinion oil, oleum infernale, or oleum ricini majoris, which contains small amounts of an irritant corcanolic acid, which is related to ricinolic acid and crotonolic acid, the principal active ingredients of castor oil and croton oil respectively. Other toxins. This general may contain hydrocyanic acid. There may be a dermatitis producing resin. There may be an alkaloid and a glycoside which produce cardiovascular and respiratory depression. Tetramethylpyrazine is an amide alkaloid has been obtained from the stem of J. podaguica. Atropine-like effects have also been reported following ingestion of Jatropha multifida. In clinical effects, ingestion. Symptoms of poisoning are likely to be similar for species of Jatropha. There is usually a delay of an hour or more than between consumption of the plant and the occurrence of symptoms. Symptoms are largely those associated with gastrointestinal irritation. There is acute abdominal pain and a burning sensation in the throat about half an hour after ingestion of the seeds, followed by nausea, vomiting, and profuse watery diarrhea. In severe poisoning, these symptoms progress to hemorrhagic gastroenteritis and dehydration. Polydipsia can be extreme. Salivation and sweating may occur. Also, there may be skeletal muscle spasm, intense hypernatremia, or a quick panting respiration is seen together with hypotension and electrocardiographic abnormalities. There may be CNS and cardiovascular depression. Children are more susceptible. This may either a direct effect of toxins or secondary to dehydration. In one report, as well as gastrointestinal symptoms, atropine-like effects develop 8 hours after ingestion of Jatropha multifida. Symptoms included sweating, dry skin and mouth, slight mydriasis, mild tachycardia, and flushing of facial skin, and persisted for 4 hours. In inhalation, there's no relevant information at the time of preparation of the monograph. In skin exposure, there's a primary chemical irritation from mechanical or chemical injury. The same with the eye contact. And in parenteral exposure, there's no relevant information at the time of preparation of the monograph. The uses of Jatropha is an ornamental plant naturalized in many tropical areas. The roots, stems, leaves, seeds, and fruits of the plant have been widely used in traditional folk medicine in many parts of West Africa. The seeds of J. curcas have been used as a purgative, antihelmintic, and abortifacient as well as for treating ascites, gout, paralysis, and skin diseases. The seed of oil of plant has been used as an ingredient in the treatment of rheumatic conditions, itch, and parasitic skin diseases, and in the treatment of fever, jaundice, and gonorrhea as a diuretic agent and a mouthwash. The leaf has been used as a hemostatic agent and bark as a fish poison. In certain African countries, people are accustomed to chewing these seeds when in need of a laxative. J. Coccus seeds have been found to be highly effective against strongyloides papillosis infection in goats. It all has also been suggested that J. Coccus seeds could be a useful chemotherapeutic agent provided that it is active and a non-lethal dose. This may be because of its reported antihelmintic activity. Next is first aid measures and management principles. In ingestion, unless the patient is unconscious, convulsing, or unable to swallow, give fluids, milk, or water to dilute. Seek medical assistance in hospital or healthcare facility in those vomiting unless the patient has already vomited or performed gastric lavage. Administer activated charcoal and a cathartic to hasten elimination, although in the presence of diarrhea, this is unnecessary. In skin, wash the affected area well with plenty of water and use a mild soap. In eye, flush the eye with copious amounts of water for at least 15 minutes. If irritation persists, seek medical assistance. General principles. The management of Jatropha poisoning is similar to that for the castor bean. Decontamination is indicated for all known or suspected poisonings. There is no antidote. Rehydration, either voluntary water ingestion or IV fluid administration, to counteract fluid loss due to vomiting and diarrhea is critical. The treatment is essentially symptomatic and supportive. The more critical analysis and investigations are fluid and electrolytes, acid base status, full blood count, and renal and hepatic function. Monitor level of consciousness. Specific therapy may be indicated for hemorrhagic gastrointestinal damage, skeletal muscle and gastrointestinal spasm, excessive salivary secretions, and hemoglobinuria. After substantial exposures to toxalbulmin containing plants, an observation period of up to 8 hours is advised. So, tuba-tuba leaves are very popularly used because of its advantages to heal dangerous illnesses. For example, reducing cholesterol level. Several researchers show that tuba-tuba leaves are powerful for lowering the level of bad cholesterol in our blood. So, ang tuba-tuba leaves nag-contain of substance that can eliminate the bad cholesterol in our blood. Bad cholesterol usually comes along with poor choices of food intake, for example, fried duck, fried chicken, and oily foods. Moreover, the oil that uses many times until the color turns black. That is the source of bad cholesterol that comes to our body. Next is healing uric acid. However, young men and young women are possible to suffer from these illnesses. Tuba-tuba leaves can solve the problem of uric acid by boiling 10 pieces of tuba-tuba leaves which are already old but ang color gihapon is sa iyang dahon still green and fresh with a glass of water. After it is warm, we can drink it twice a day. Next is healing diabetes. The level of high blood sugar in our body can be neutralized by drinking the boiling water of tuba-tuba leaves because it can level down the level of blood sugar into its normal level. Lastly is it can cure cancer. Tuba-tuba leaves are powerful to cure cancer 100 times stronger than chemotherapy. So, magkuan kag 10 pieces of old tuba-tuba leaves then i-boil with a glasses of water three glasses of water until it becomes one glass. Ang pag-inom is twice a day, every day for 2 weeks. So, maunang they are said stronger than a chemotherapy because they are powerful to diminish the growth of abnormal cells and facilitate the normal cells to grow well. So, that's all. Thank you.